So I'm Dr. Manish Bankar. I'm the medical director of Nova IVI Fertility. So ET Healthward Conclave is a unique innovation from the Economic Times, which covers all areas related to fertility care, right from the clinical aspects to counseling to instrumentation, technology, business models, regulations, accreditations, etc. And what is very important and what is very commendable in this, that all the stakeholders in this field have been involved in this particular event. So if you look at both the service providers and the patients, one of the primary concerns is to get correct information so that from a practitioner's point of view, how they can benchmark their services to the best in the world, and from a patient perspective to come to informed decision as to where to obtain the treatment. So registration and regulation will help both the service providers and the patients arrive at the right decision. It's a very difficult question because first of all, pricing is something which is linked to what a service provider provides. I would rather tell what is more important is transparent pricing, because you cannot tell what a physician should charge for his or her services, but transparency in this area is of prime importance. And once we have a regulation in place, this is not difficult to achieve. Funding is an important issue because a vast majority of our population may not be able to afford the right kind of fertility treatment that they need. And some amount of funding, be it private in the form of insurance or from the government, will definitely help in improving the access that these couples have to have their fertility treatments carried out. It begins with your vision or the philosophy on which you are going to base the center. You then need the people, you then need the infrastructure, you need the technology and the expertise, and then you need the accreditation and the monitoring to provide a complete set of transparent, cost-efficient, and really ethical treatment. So what I would like to achieve at the end of the day's deliberation is some active movement in the form of formulating a registry, because regulation is something which is in the government's hand. There have been enough efforts and efforts are going on, but formulating a registry is completely within the clinician's perspective. So if you are able to achieve some movement in that direction, it would be of great help.